Alright. We're going to come right in here, Angela. I'm going to have you stop at the sink. I'm going to have you wash your hands for me, please. And then I also do have a mouth rinse here for you. It's half peroxide, half water. I do need to rinse for a full minute. It's just protocol here in the office just to make sure everybody is safe. Gloves. All right, I'm gonna have you have a seat here. How you doing today?
I'm great, thank you. How are you?
Good, 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 good. So today we have you in for the crown on your upper right. Is that what you remember?
Yes.
All right, wonderful. I have some safety glasses here for you. Gonna get this on you here. So what I'm gonna do first actually is I am going to take an impression, and that impression is gonna help me make the temporary for you, okay? Okay. Just gonna pull your hair up here. Do you have anything fun planned for the rest of the day?
Not today, but my birthday is this weekend, so
Aww,
have some
happy
nice
early
plans.
birthday.
Thank you.
So we're just gonna fill the tray up. We only need a little bit. Other side, slide them out. What we're gonna do is we're gonna place it. And open for me, please. And then what I'm gonna do is I'm just gonna have you bite down into that the whole way down. Great. That's gonna stay in for about 30 seconds to a minute. And in the meantime, while you're doing that, I'm just gonna test the hand pieces, make sure everything's going good. I'm gonna put a burr into the hand piece. I'm gonna sit on the hand piece, let it run. Make sure everything's running properly. Nothing's going on with that. And then I'm gonna do the same thing with the slow speed that has the round burr in it. Dr. Simone always requests a slow speed to have a round burr in it and already ready for him to go. That's all good. And then typically while she's biting on the impression, I will come over here and I will get started with patient's name. I'm going to fill in the area that we're working on right here. I'm going to fill in the doctor, phone number. And typically all of our crowns are usually a Broxier crown, so over here on this little side, you're going to cross off the Broxier. If it's an anterior case, sometimes it's a Broxier anterior. A lot of the times if it's just a single, veneer, we do Emax, which Emax is over here. Alright, and then I put please fabricate. And then we're just going to put just out of occlusion. Alright. I'm going to come back over here. I'm going to have you open. Beautiful. Great first impression. Alright, so I just kind of want to touch base on what we use here in the office. This is called our IsoDry system. It's kind of a little squishy mouth block. What it does is it protects your lips, protects your tongues, and it actually suctions for you. So typically what we do is we just kind of, to try to figure out what size fits the patient's mouth, we just kind of lean it back here. What I'm going to do is I'm just going to do the 3-finger test, okay? So the 3-finger test allows me to know what size is going to fit into her mouth. I'm just going to have you open. So this would tell me that I could do anywhere from a medium to a medium DV. A large might be a little kind of like forcing it, so I wouldn't try it just because she has typically a smaller mouth. You can close and relax. So typically what I'm going to do today, because we're working on the upper right, I'm going to use a medium just because there's not a lot of material. Really don't need to push the tongue away or the cheeks as much on the upper. Best thing to do when you are putting the IsoDry system on is get a little wet and then it'll slide right in. Makes it so much easier for yourself and for the patient and for the doctor. Alright. So then typically we'll just leave this here. And then what I'm going to do next is I'm going to place some topical on the upper right area so that when the doctor comes in to get her numb that she won't feel, any type of pinching or anything like that. Dry the area. The area needs to be dried for the topical to work. If you don't dry it, it's not going to work. So then I'm just going to have you close down. Perfect. That's going to sit in there for a second. I'm gonna go let the doctor know that I'm ready. Again, my name is Melinda. If you need anything in the meantime, please let me know. All right, so our patient in the chair today is gonna be using nitrous. So the first thing that you're gonna do is you're gonna come in here, you're gonna open the door, you're gonna turn both of these on. Just the whole way on. So that means that everything is ready. You have to hear the hiss. As long as the hiss is going, then we are good to go. We're gonna go back into the room. While we're walking down the hallway, we're gonna turn on a little switch here, make sure it's on, all lights are green. I'm gonna come back into the room, and then right under here is where you're gonna get all your nitrous hoses. So then basically you're just gonna take it out of the bag. There's two different sizes, one's bigger, one's smaller. You're going to place those in, get that ready, and then even down in here, there's a little lever that you're gonna kind of just switch, just give it a little bit of air, get it ready for the doctor. Not too much, you just wanna hear a slight hiss. All right, there's a little sticky thing here on it that you're gonna take off. I'm gonna leave that there. We're gonna come around and we're gonna get this started. Just pull the nitrous or the glasses up. One of the nostrils will actually go into the nose. And then you're just gonna pull your glasses down over. Awesome. All right, Dr. Simone, we have Angela here today. She is in for a crown prep on the upper right. She also is gonna get nitrous today, so we got the nitrous ready and started. There's a little bit of dental anxiety, so we can kind of work with her. She has two small children, a boy and a girl. And her birthday is this weekend.
Ah, happy birthday, Angela. Thank you so much for coming in today. I'm so excited to be working with you. I'm Dr. Simone. It's my pleasure to help you out any way I can. Just to confirm, we have you for a crown on your upper right tooth. Is that what you remember?
I think there's two of them.
There's two up there. Let me double check the chart and we'll see what's going on.
Sure.
So important that you bring the patient in, you use the patient's name like Melinda did, you welcome them to the practice, and then you thank them for coming. They could be anywhere. A patient would rather take their money and go to Best Buy or go to the Apple store or go to the mall and spend the money there. We need to be happy and appreciative and thankful that they're coming here. Right? We also want to double check why they're coming in. Sometimes patients get confused, right? So it's so important that everyone's on the same page. Also, it's a safety check measure. When you're putting in the procedure for the next visit, there could always be a misclick on the computer, right? It's human error, it does happen. We seek to have the best systems to minimize human error, but it can always happen. So it's really important you call a timeout, you look at the tooth before you get the patient numb, you can make sure it makes sense that it needs a crown, that you're the doctor, it makes sense it needs a crown, make sure that the informed consents are signed, everything's been documented, and that everything in the computer, all the paperwork, is up to date, completed, and like I said, makes common sense. That like, all right, this is a good decision to do a crown on the tooth. Once again, these are the sticky system we use. We use them for every patient, not just hygiene, but for all patients. It says exam note, it has a time, patient's name, the operatory location, if it's a new patient or existing patient, and what we're doing, you write down. It's designed for hygiene, but we use these for restorative. The idea is that you give this, if I'm in a room and I'm working on a patient, I don't want to be interrupted. It's like, oh, Dr. Simone, we need you in room 4. And then I'm getting to work on Angela here, and the next assistant comes in, or the next hygienist comes in and says, oh, we need you in room 1. That doesn't look good. That's off-brand to the patient. The patient's thinking, what about me? Am I important? Everyone's interrupting me so Dr. Simone can leave. So this is a great way to stay on brand and to communicate who needs to be seen. It's also great so when I can grab it, I know who the patient is. It says Angela. It says she's an existing patient. Circle new patient, existing patient. It's very awkward for a doctor or a team member to walk into a room and go, hi Angela, nice to meet you. And she goes, I've been coming here for 3 years and all my kids have braces. How do you not know my name? Or worse, I go to Angela, welcome back, and the patient goes, I've never been here before. So super important that you use these for every patient and they're fully completed. If it's restorative and there's just right what we're doing. CR number 2. We know it's a crown. It gives us something to go off of. If there's concerns, you write it down. Patient is pissed off that their temporary came off 4 times, right? That needs to be put in there. It's a very important thing. Or concerns, or if they're happy about something, put that down. Daughter just got married, so I can walk in and say, hey Angela, I heard your daughter just got married, and it really helps to build rapport and trust and makes the patient feel welcomed, and that's what we're after. We're after the patient having an amazing experience.
All right, so the first thing you're gonna do when you're going to make the temporary is you're gonna take the preliminary impression that you took. You're gonna fill the teeth that the doctor prepped, just like this. And then you're gonna place it back into the patient's mouth. Go ahead and open for me, please. And bite down. And that's gonna stay in for about 2 minutes. All right, so now we're just gonna trim the temporary here. We're gonna make sure that all the edges are the same width, same thickness, make sure that it's nice and clean.
Oh, dude, I love you, dude.
He's looking for Candace. All right. So if you just want to take a look here, it just makes it so that all the edges are nice and smooth. This little spot right here, I'll just kind of smooth up a little bit more. And then typically what I would do is I would kind of just polish these cusps down a little bit. So I'll use a different type of burr. I'll use a bigger one here. Typically I use this one, it's a blue football. I just kind of take off the edges of or like the cusps here in a sense. The only reason I do that is so that the patient doesn't lose their temporary by bite occlusion, especially if they're still numb. Just kind of smoothing it up. Now, let's say the patient had a root canal in the tooth. What I want you to do is I want you to line the actual prep with some Vaseline, and then you would use a temp bond to place into here. Temp bond is strictly for anyone that has a root canal tooth. Typically, we use a drop of flowable on the buccal side. So we would just put a drop of flowable right here and a drop of flowable right here. And that's how we would cement this in temporarily until they get their permanent crown. I'm gonna come over. I'm just gonna dry the area a little bit here. A little bit of air. And then I'm just going to seat the crown here. A little bit of pressure just to make sure it's nice and smooth. And then I'm just going to do a light cure on each one. Typically, if you're not an EFTA, I would suggest that you check the bite before it goes into the patient's mouth. Just because you can't put the handpiece in the mouth. I am an actor, so it makes it a little bit more easier for me where I can just kind of polish things and kind of get it out of the way. Alright, do me a favor and bite. How's it feel when you bite?
Right.
Awesome. Alright, and that's it.